I think that OT is the least well understood of the therapy professions, primarily because the name is a little bit confusing.
Liz May is an occupational therapist at Cleveland Clinic Children's Hospital for Rehabilitation.
Occupational therapists help people across the lifespan increase their participation and independence in meaningful daily activities. Occupations is really just like a fancy word for things that occupy our time. So anything that we do during the day that occupies our time, that's like a meaningful activity, that's something that OTs might work on. There is a lot of overlap between occupational therapy, physical therapy, and speech therapy, and there are definitely some instances where all three disciplines might see the same patient or child. Personally, I think of occupational therapy as being like the most holistic of the therapies. We are trained to look not just at a physical impairment or a specific problem, but we look at the person and the environment and the activity that our patient or client is working on. And we try to find ways to modify the activity and the environment so that our patients can be more successful and independent. I think a lot of people that self-select occupational therapy as a profession are really creative. And so I think that OTs are very creative and that we're expert problem solvers.
Some reasons a child may be referred to occupational therapy include developmental concerns, injury or surgery, strength deficits, fine motor concerns, or sensory processing disorders, to name a few.
Working with babies and toddlers, we might be working on this developmental milestones, or maybe working on feeding, accepting food by mouth. In a school setting, kids might be working with an OT on handwriting or fine motor coordination, sensory processing, attention, things to help them be more successful in a school environment. And same in an outpatient setting, they might be working on some of those same skills, or maybe working on increasing their independence and some self-care skills. And then on an inpatient side, we might be seeing kids after an injury or trauma or accident and working on recovering some lost motor skills or physical skills. I think the best thing about being an OT is just the opportunity to build relationships with my patients and their families. I think that we, on an inpatient setting, see our patients at a really challenging time in their lives. And kids are so resilient that the work that we do is really rewarding and really fulfilling. And the most important thing that kids do is play. And so a lot of what we do in pediatric OT is play skills and things that are really fun. So I feel really lucky that I get to work with kids while they're recovering from something traumatic and help them just play and have a fun time.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.